Good afternoon, everyone. It is Dr. Kyle with Chiropractic First of Rockford. Today I want to talk a little bit about pregnancy and how it's managed, and specifically some of the dangers that come with taking over-the-counter medications, non-steroidal anti-inflammatories, commonly called NSAIDs, really the most common form of medicine that's taken in our country, and mostly done, of course, to manage pain, manage the aches and pains that come with daily life or chronic injury. But when it comes to pregnancy, most women are aware that you should avoid the prescription medications. They're managed with their doctors. They know that there are risks for those heavier drugs, but oftentimes over-the-counter medications are overlooked. In fact, one study that was done by Kaiser Permanente, one of the largest insurers in the world, looked and they said how many women in their first couple weeks of pregnancy are taking these anti-inflammatories because they either didn't know or they didn't understand what it was. And they said that 80% of women within the first 3 weeks of their pregnancy were taking an anti-inflammatory. So there's a poor understanding of what the effects are, and here's why women that are pregnant, whatever stage you're in, should not be taking anti-inflammatory to manage pain. Within the first couple weeks in the first trimester, if you're taking an anti-inflammatory for more than, especially more than 2 weeks is the highest risk, but if you take it during that time, you have an almost 400% increased risk of an early miscarriage. At any time during the pregnancy, if you're taking an anti-inflammatory for a prolonged period of time, it's a 60% increase in miscarriage during that. So there's really not a safe time to be taking those without a risk of possibly terminating that pregnancy unexpectedly beforehand. The other thing that happens in the last trimester, once you reach 32 weeks or more, women that were taking NSAIDs at that point to manage their pain, they increase the risk that the child's heart will have a duct or a vessel closed prematurely, which affects the maturation of the heart and can lead to a lifetime of heart issues and higher risk for things down the road like medication use, blood pressure issues, and heart attack. So there's really not a safe time during any stage of the pregnancy to be taking one of those, but unfortunately there's just so few options for many, many women that are dealing with pain that arises during their pregnancy. They feel they have no other option, or they just don't know the risks that are associated with it. So that's why I wanted to take a few minutes today and talk about that. Now, if you've watched the last couple of videos, or you can go back a little bit on the timeline, you'll see that when you're pregnant, there are certain hormones that are released that relax muscles and ligaments. They create laxity in the spine, which oftentimes will expose previous injuries or inflammation in the spine, nerves, or joints that maybe wasn't there before. And so back pain and sciatica are some of the most common things we see with pregnant women. No matter what stage of the pregnancy they're in, there's a higher risk of that developing, but especially as the child gets older. And there's so few options out there for them. Chiropractic and other manual therapies, as well as safer alternatives like acupuncture and massage therapy, are tremendous and offer huge results without the risk that comes from taking a prescription or an over-the-counter medication. So there is hope out there, and I want to spend a few minutes today just reminding why it's so important to protect your health and protect the health of that child by avoiding those over-the-counter medications that so many don't know about. So if you know somebody that's pregnant and is looking for help, please share this information for them so they have a full understanding of both the risks that might be there, but what the options are, which is most important. And if you like this information too, drop a comment in the section below, like the button so you see updated videos. We want to make sure we're giving you the material, the content that helps you and your family, your loved ones, your neighbors live the life you deserve to live without the risk that comes with unnecessary procedures. Have a wonderful day. I can't wait to see you again next time.